So let's start with the stem. What's really the question asking?
To prevent the spread of the infection.
Right, how do you prevent the spread of infection? So out of those four, to prevent the spread of infection to other clients and healthcare providers. Right, so best answer out of these four, so eliminate the reservoir. What's the reservoir?
The patient.
You could be a patient, but wherever the bacteria is, block the portal of exit from the reservoir. Sounds good. That means, and how do we do that? Block the portal of exit from the reservoir. Well, block the portal of exit from the reservoir would be like cleaning something up. Block the port of entry into the host. And decrease the susceptibility of the host. How do we do that? Decrease susceptibility of the host. You know, helping somebody's immune system out, like that's gonna decrease
I'll
susceptibility.
send you a link.
So-
What's your number?
Block the, it is gonna be block the portal of exit from the reservoir. So our main thing's gonna be what? It's not a direct, but it's something like, you know, hey, how you doing there? So what's the correct order to put on PPE on the right side of it? What do you put on first? Okay, beautiful, next. Which ties you put up first? Yeah. Top first, then lower ones. Then next you put on goggles, then bonnet, then gloves.
This is going to be on the test.
Then what's the right order to take them off?
Gloves. Gown. Well, if you go by the book, it's bonnet. It's bonnet. Yeah. Mask goggles.
How we supposed, what comes off first?
30th.
So it's gonna be
Gloves.
gloves. Then next is gonna be,
Gown.
and how do you take it off?
Away from
Yeah, shimmy it down, turn it inside out. So next is gonna be, this is just the book version now.
It's the bonnet.
Bonnet. Then next is gonna be goggles, and then mask. And so which tie do you do down first? Do you take up down first? Bottom and the top. Same thing, you're gonna fold it inside, you know, inside out.
That's going to be a good test question right there.
Could be like this. Could also be like dressing change. What else do we do steps to? Thinking about like the content. This, suctioning, could be suctioning, went to dry dressing change, catheterization, that was a step one. 3 examples,
that those that they're supposed to have.
put them in order. So what I just say, PPE, dressing change, catheterization, suctioning.
What do you do first? Then second. Is this gonna be a fill in type of thing, or?
It's a put in order, just like
So the
this.
answers are already gonna be there, we just need to put them in order.
So, caring for a client, people cold blood at home. So what's important to tell somebody if you're doing fecal occult blood testing at home? So let's start with the stem. The biggest point of the question is, what's important about fecal occult blood testing, really? Out of these, so it's asking for the right answer about fecal occult blood testing. So which one of these is gonna be always right? D. D, right, because eating more protein optimal prior to testing, what's the issue with that one? Yeah, what gives you a false positive?
The results from the test, because it'll say that it's blood in there, but sometimes it's from the actual product we eat.
Right, what type of proteins? Highly suspect.
Red.
Red meat.
Yes, red meat. I think red meat is gonna be on your stool. So one specimen is sufficient for testing? No, you need, usually it's 3, depends on the facility. So red color change, now what color does it change to? Blue. So specimen cannot be contaminated with urine. That's true, it's always gonna be true. We say, we get at every meeting we have nearly about nutrition issues. So this is the lower end, still about nutrition here, so. Gotta keep those up. Okay. Reporting pain despite taking analgesia. So this step is about how we determine intensity.
C.
Okay, so yeah, how do we determine intensity? So ask the client what precipitates, so out of these choices, A is a good one, but is that gonna tell us about intensity? Question about the location, important, not gonna tell us about intensity. Pain scale, sounds very good, ding, ding, ding. And then D, open-ended questions, a good one, but is that gonna tell us about intensity? So 4 things are correct, but C best pertains to the question. Because of the scale, we already said different scales. So we had 0 to 10, numeric, visual analog, where they're gonna go on a time, on like a little line. The faces, because you can even use faces for people who have cognitive impairments. Black, infants, and the cries. So, types of pain, we hit them already. We know referred's gonna be when it travels around along kind of a dermatome path. We did acute and chronic, so acute's within 3 months, chronic's really longer than that. We did phantom is gonna be after what? Amputation, because it's still, still getting a nerve signal there. What else? How about visceral? What's visceral pain mean?
Inside.
Like a tightening?
Yeah, so you get deep inside. Compared to superficial is like scratch or cut. Visceral is gonna be in your with your organs. What other types of pain? Yeah, somatic's gonna be of your,
System.
just of your body, somatic pain.
So that's-
So factors that influence pain is gonna be what? Didn't star that one, if you get my drift. What influences pain?
Well, your perception of pain.
Yeah, your perception, so the pain, just what we already said, the patient's experience, like kind of their experience with pain.
Tolerance.
Yeah, what their tolerance is like. Can be your culture, kind of like how you behave culturally to pain. Some people are more stoked than others, so big bias, but it's always a hot question. What else? Your experience with healthcare. If you were in a hospital when you were a child, your pain wasn't treated well, you're always gonna think it's gonna be a bad experience all the time. So important factors that influence pain. And like I said, threshold means, well, like when you're really, when you can sense the pain, when a patient can sense the pain, you reach a threshold for pain. Compared to tolerance means, if I'm tolerant to medication, that means I need more of the agent to get pain relief. And we already said physical tolerance is I'm gonna have withdrawal syndrome if I stop it, compared to psychological tolerance. think I am getting some non-physical gain from it. I think that's really, I think we was also gain things with the Kahoot and this. All big stuff, right? Okay, our favorite. So I will, you should get see it. Nurse performing an admission assessment of a client who has hypovolemia due to vomiting diarrhea. So which of the following are everybody's, reading of everybody's existence? Select all of them.
C.
Hypovolemia.
C, E, and D.
Right, so low volume. I'm not gonna have distended neck pain. Distended neck pain is gonna come from hypervolemia. Would I have hyperthermia? Hyperthermia just means what?
So elevated temperature.
Yeah, elevated temperature. So, you know, may or may not have hyperthermia with hypovolemia. It could be a cause for you getting to, you know, having less fluid because you're burning so much off, but not a direct one. Tachycardia,
Definitely.
yes, that's my heart's gonna beat faster to get the blood all around my body. Syncopes, medical for passing out, falling out, done fell out. Fell out at church. I don't go to church. And decreased skin turgor,
Yes.
yes. How we checking skin turgor? Tensing. I didn't have the answer, but it's what is it? Tachycardia, syncope, decreased skin turgor. So who's at highest risk for hypervolemia? Hypervolemia. Same as volume overload. So stop to the stem, who's highest risk for using one word. So 54-year-old difficulty swallowing after stroke. What would they be at risk for? Hyper or hypo? You're hypo because you can't get it in. 41-year-old who has not a bowel movement in 3 days.
That's nothing.
No, not someone with fluid. 61-year-old with excess anti-diuretic hormone production.
Ding ding.
I'm gonna be retaining fluid day. And 74-year-old who has 3 times the recommended dose of calcium carbonate and antacid daily.
Kinda, but no.
Highest risk for hypervolemia. Somebody just said it, some smarty said it. Gonna be C, fabulous, C. But how about these other people? So difficulty swallowing after a stroke. Say they have really difficult swallowing, high risk for aspiration. Their GI tract is still working, but they really can't swallow. What type of nutrition would be good for them?
Enteral.
Yeah, NG tube, G tube, J tube, but enteral nutrition. As long as your GI tract is working. But yeah, and they could be, you know, they could need some IV hydration. So 41-year-old has a bowel movement in 3 days. So what do they need? Well, they couldn't. But remember, you always have to think non-pharmacologic first. So before we start, we have to do what? First step in the nursing process is assess. Right? What's their usual bowel pattern? Maybe they don't go every day. Like some people might just go every 3 days. Maybe that's normal for them.
Some people only go weekly. So you do have to ask their bowel pattern.
Right, so assessments first, so assess what their usual bowel pattern is, number one, and then what's the next step? Decide whether it's a problem for or not. If it's a problem, if it's not a problem, don't worry about it, but if it is a problem, well, no, I go 2 times a day. Okay, so you haven't gone 3 days, and now what? What will we do next? Well, what are we gonna further assess? If they say it's a problem, then we assess where? Right. Well, remember, don't just dump the bowel sound. What are you gonna do first? Inspect, right. Inspect, auscultate.
Palpate.
Feeling cute. Copy. And now what? So say, yes, you have not pooped, you feel uncomfortable, hyperactive bowel sound, you're distended. Now I'm going to, now I can do an nursing process. I defined the problem, so now I'm going to,
Plan.
now I'm gonna intervene. So what, and non-pharmacologic, not a doctor, so I'm gonna say,
Sit up.
get up, right? Get your lazy butt up and drink some water. Have some shredded wheat. Move around. And then how am I gonna make sure that that's all working? Right, see if they poop. So assess their bowel movement. Reassess. So constipation, helping your review. Risk factors for constipation gonna be what? Dehydration. What else?
Medication.
Could be medication, even simpler, immobility. What else? Right, inadequate fiber, right. Fiber sources besides that, shredded wheat could be
Green leafy vegetables.
always a great answer. Yes, always, it's always really good. What else? I'm gonna help you go.
Coffee.
Coffee, could be smoke, she can't say that, but. What else? Food wise, just make sure they're eating like, you know, the skins on the fruit instead of peeling
Vegetables.
stuff.
and things.
Using fresh stuff
Fiber.
instead of canned vegetables.
Oats.
Punch them in the gut.
Yeah, soluble fiber. Okay,
Finger
what do
in
we
the
do about this ADH person? So hypervolemia. Somebody, so now we know they have hypervolemia. So good things to do are gonna be what? Nursing process. We're going to assess what?
For edema or
Yeah, good one. We can look for edema, we can palpate edema. Those are two things.
the vein or the skin.
JVD.
Their vital signs, their, you know, their venous, like do they have JVD? What else? Simpler. We could get their daily,
Output.
wait, right. And their output, but output's a good answer too. We said Rich said vital signs, so we think they're probably gonna be what? Could have hypertension, could, if they're really volume related, they could have tachycardia too. Could they be short of breath maybe? Possibly, if they have that much volume overloaded. So good. So now we're gonna get the full socks, make it sit them up, all that. Okay, now 74-year-old. So now I'm taking 3 times as many Tums as I need. Calcium. What electrolyte imbalance could they potentially have? Oh, yes. Woo. They could have metabolic alkalosis from taking a high dose of antacids. Beautiful. And what electrolyte? If they're taking too much calcium carbonate, hypercalcemia. Yeah. Too much calcium. So if I have hypercalcemia, what was that little mnemonic? It was horrible, not a horrible way.
Bones, groans.
Yeah, bones, stones. So constipation, joint pain. What else do you do with hypercalcemia? How do we get rid of the extra calcium then? Get rid of extra calcium by,
Liquid intake.
yeah, IV hydration with diuretics. Really gonna urinate it away. But thinking possibly to Saturday, What do we do about low calcium? Low calcium, there's two signs, Chivastic, tapping the cheek, and the other one is Trousseau's for the blood pressure. So you have to, review those hypo, calci, all those hypo things, what causes them, what we do for them. Calcium, magnesium, potassium. Big three, write those down. Calcium, magnesium, potassium.
And then like the relations with them too, like with phosphorus and stuff, or no?
No, we'll get to that later on, but just what causes the imbalance and what are we gonna do about the imbalance? Do not mix up potassium and vitamin K. Vitamin K, remember, in the green leafy vegetables, potassium's abbreviated K, but it's different. I'm telling you that clearly for a reason. Dig me.
I always got it confused, all got ways. Until, as a student,
Okay,
on the computer, I get it confused,
so somebody 175 pounds who has dehydration. So what are you gonna do? Out of these 4 actions, which one's the safest one? Safe, reliable.
B.
Beautiful, yes, B, beautiful. So, cause if they're 175 pounds, now break up your calculator, how we change that to kilograms? Gonna multiply or divide?
Divide.
Beautiful, divide by 2.2. Comes out to like 79.45. This is gonna be 79.45 times 4 hours, times 1, it's still the same number, times 4 hours. So 375 is greater than that number. So 375 in 4 hours is an appropriate urine output. You don't have to call about that. That's not something to be worried about. That's what they should be having. So why would, give them a daily oral antihypertensive? What's gonna be the issue we do that if somebody's dehydrated?
They have low blood pressure to begin with.
Right, could make their blood pressure go down lower. So, yeah, they might need it, but what do we want to do first?
Assess.
Yeah, assess their
Vitals.
BP and
Vitals.
heart rate. Blood pressure and heart rate, remember, always go together. We don't want to just not give it, but, because remember, that was one of our big 10 rights. So let's hit those. So it's going to be right, patient, drug,
Dose.
Dose.
Time.
time, route, documentation, yeah, the new school ones, assessment, education, evaluation, refusal. Like to, let me keep refusal at the end, because we want them to take it, hopefully.
you do more to
And then how about,
Dick.
so yeah, we definitely wanna check somebody's weight if they're dehydrated, easy one. Because that's not even on the test, but I won't say it. So what about this encourage independent ambulation 4 times a day if somebody's dehydrated? What's that a risk about? Where's, might be a problem? Yeah, right, fall risk. So we don't want it to be independent, it should have some assistance. Okay. Research nurse learns that, I want first. Dr. Neil Moore. So, non-English speaking clients are in a drug trial. There's no documentation of consents in the files. Interpreters available by phone. These clients are uninsured. We'll finally be able to help them. So the nurse knows these 4 choices.
A.
Go through them all, but, so informed consent is required for all human subjects, that true or false?
True.
True. Informed consent means what? I know
The risks and
risks, benefits, and I can opt out anytime. There's an informed consent and there's a research question that covers all of those. Right, that little A. Question. So beneficence is more important than autonomy. So beneficence means, well, beneficence just means I'm doing something for somebody's benefit, I'm doing something good, is more important than a person making a choice. It sounds nice, but that's not true. Like, just because we're doing a good thing for them, doesn't mean they should not have a right to refuse it or not. And then important to support the research is utilitarianism. Utilitarianism means what? That one's the greatest good for the greatest number. So make sure you know the utilitarianism versus deontology. Deontology, that was, you know, everything should be the same for everybody. Not always the case. And then this is not an ethical dilemma because there's a positive result. What constitutes an ethical dilemma? A couple factors for that were what makes something an ethical dilemma?
religion.
Knowing to do the right thing and
When the 2 people, say like if the patient and his family, and he had 2 different outlooks on, like if the patient don't want something done to him, but the family want it done to him. And then it's a dilemma because they gotta go with the patient, but the family wants something else done.
Right, there could be 2 unfavorable outcomes. There's 2 choices, but they're both kind of, there's no clear answer. They both could be bad choices.
I was thinking like McDonald's or
So that's somehow on there. So just to, I think we hit them all. Definitely informed consent on there a couple times. You know, the utilitarianism versus just know your terms, your autonomy, utilitarianism. Okay.
What lecture is that?
So it was in ethical,
Ethics and values.
there was one about ethics, values and ethics, and there's one legal aspects. So, sorry, I didn't have the choices there. They're not all together. So admitting a client and completing a pre-assessment before giving admitted medication, so you're at the assessment phase. Which of the following should a nurse include in the pre-assessment? So what are you gonna ask the patient before you can give them the medication?
Oh.
Let's just select all of them.
A.
C,
D.
E, D.
Right.
Well, all of them, pretty much.
Well, definitely.
Well,
I
not
think
B,
they
maybe not
should-
B.
Herbal teas, remember you wanna ask people about herbal supplements, anything, anything that can interact with medications. We are concerned about, hydration status sometimes, but they're just trying to keep it simple. Definitely current health status, and remember our 2 big things we worry about with medications are for excretion, main organ for excretion is
Kidneys.
kidneys, beautiful, and main organ for metabolism is
Liver.
Liver.
Beautiful. And so there's surgical history. I know in real life this is different, but for this question it's just gonna be A, C, and E. Great answer.
Wow, that's a bogus question.
I know it's not real life, but out of these, it was just A, C, and E. I could argue B too. Okay. Primary care provider orders peak and trough levels for an anticonvulsant agent. What's the rationale for doing peak and trough? Why does somebody get a peak and trough level?
To know when the medication's at its,
Right, you wanna make sure it's in a therapeutic range and not toxic, not too much, or not sub-therapeutic. So that's why somebody does peak and trough. So if you get the drug at 8 o'clock, what's the optimal time for the peak serum level? If it's IV drug?
8:30.
Yeah, 8:30, 9, anywhere there, like right after. So when's it gonna be, so that's gonna be the peak. When would it be at the lowest level? Right, so yeah, it's gonna be, so if it's talking about the trough level, that would be 7:30. 7:30 PM, 7:30 AM, well, 7:30 AM for the next day. It's gonna be this lowest level right before the next dose is due. Other ones in there, would such as something having a longer but if one drug has a longer half-life than the other, it's gonna be what? Longer between the dosing intervals. So things that have a longer half-life, you don't have to take them as frequently. What else is a big one in that?
We're gonna be at like 4 half-lives. People study.
It's not longer, I'll just be honest with you. It is 4 half-lives for something to reach a steady state, or to be 0, but you can hold on to that for that tidbit for later.
The only way you can answer that question about the trail.
is knowing the
would be if you
half-life.
knew when the next dose would be, correct?
Mm-hmm.
Right, because it doesn't give you the frequency there.
Okay.
This was just saying, what's the peak, but right. They'd have to tell you that it's every 12 hours, or every 6 hours.
Okay.
Trying to think any other big concepts on there. We talked about toxicity, being subtherapeutic, adverse effects within the Kahoot. All right, unit council members, reducing medication errors. Oh, it doesn't say select all and apply, it says select all and apply.
B, C, D.
So unit dose is something that's already pre-measured.
Yeah, A, B, C, D.
So smart pumps means that the drugs are programmed into the IV pump already to, hard to make a mistake. Good. Automated dispensing cabinet, so that's a Pyxis or Omnicell. Great. Unit dose administration, so the pharmacies are gonna send the correct dose for the patient. So it's already in a package, that's where we go through scanning it. Barcode administration, again, safety, I'm scanning the patient, I'm scanning the medication. Extended release formulations, is that gonna help with errors?
No.
No. It's gonna help with compliance, helps the patient out, but it's not really gonna help avoid errors. So, A, B, C, D. So, you're controlling your anxiety. This is a Zen moment, this is the section, self-actualization. So read the STEM, look for keywords, bring highlighters, bring, I don't know, good luck trolls. But just, bring stuff.
Can I bring the answer key?
Book bags, though.
No, I have coffee.
Read each distraction, so which one really best addresses the STEM? And we're always going back to the STEM. For the evil, select all apply, because they are evil. None of us like them. But is it true or false, and does it apply to the STEM? If it, it might be a good thing, but if it doesn't apply to the STEM, it's not an appropriate answer. Okay. Discard ones that have incorrect information who do not apply to the STEM. That's whether it's a traditional one or select all and apply. That's not talking about that. Even if it's correct information, go back to the STEM, go back to the STEM. everybody, we all crack up and put crazy ones. Like, you'll look back and be like, why did I put that? We're gonna minimize this, because this is a long exam. We're just gonna curse right there, but it's a long behind exam. 100 questions. You gotta pace yourself. I
But
wish
in
you
the
could.
scheme of things, they've had 75 questions on one,
Mhm.
right?
Well, wasn't it always 70? I don't think there was ever 75.
I think we had 68. Highest we had.
Go ahead.
Is there any way you can have our coffee while taking the exam? Like, can you check our containers or?
You can put your finger in it and stuff and make sure there's no.
Paper coming out, your jacket box.
I feel like saying yes on that. Honestly, God, I mean,
It's in the morning.
That's gonna make it be less stressed.
Yes.
We'll do it.
Thank you.
Order, drink, soda, coffee.
but, and I'm not trying to, we're not going into the bathroom with anybody. I'm telling you that right now. But if you have to go to the bathroom, which you might in 2 hours and 45 minutes, I'm gonna have to go to the bathroom. More than one time. We have to wait outside the bathroom with you.
Really? Me, really?
We should do that for regular exams too.
I know.
I mean, I don't think it's really, I think of all the exams we had, I think one person got into the bathroom.
I'm talking about I have them in the middle.
Once the exam
Just start just check my paper.
starts, I'm gonna go check the women's room and the men's room for any notes left behind. Shady, I've had shady students in the past, and I do trust you,
Really?
but
I
I
don't
want
trust you that much.
for my own, so I feel good about it being safe.
I missed the pizza. Remember that, the pizza thing?
People are crazy.
Yeah.
I've
What
seen
made it?
it a
The whole
lot.
semester?
I'm not doing it. Okay. This last point is probably the most important. Do not change your answers. Generally, I mean, there's research that shows this. Generally, it's the first answer you put that's the correct one. I'm looking at you.
Shaking.
Don't change it. I'm trying to help you. I'm trying to help you. But really, when you go back and check your answers, you're just making sure that you filled in all the bubbles, like you don't have any, you're just double checking, confirming that you, filled in everything.
How many left over?
I didn't count them, but there's not a hell of a lot.
Like two? I always think there is. I always think there's too many.
47.
There's not a lot more.
No, I mean, it's proportional.
So there's no like number that you have to.
Sorry guys, I'm getting really tired. I just had a bad week.
Teachers are rearranging calendars.
No.
How much math counts? So it's 5 of 8. I have 4 Kahoots, so I'll send you the one we did plus the other 3.